Thomas Baldrick here at ASH 2014 in San Francisco with Dr. Shaji Kumar from the Mayo Clinic, here to talk about his phase 2 study results. Thank you, sir, for stopping by.
My pleasure.
Can you give us an overview of what this study is and why you did it?
Absolutely. So patients with myeloma definitely have much better outcome today compared to 10 years ago, and that's because we have new drugs. And two classes of drug in particular has helped improve the outcomes of patients with myeloma. They are proteasome inhibitors and immunomodulatory drugs. So the proteasome inhibitor, the very first one that came to the clinic was bortezomib or Velcade. And the immunomodulatory drugs that are being used in the clinic right now are Revlimid or lenalidomide and pomalidomide or Pomalyst. Now, a combination of a proteasome inhibitor and an immunomodulatory drug is probably one of the most effective combinations that we have for treating myeloma today. So a variety of different combinations have been studied. Velcade has been studied with both Revlimid and pomalidomide. Carfilzomib, which is a newer proteasome inhibitor, has also been studied with Revlimid and pomalidomide. Now, one of the problems that we have with the current proteasome inhibitors is that it has to be given intravenously or subcutaneously, which means the patients have to come to the clinic at least once or twice a week. The Velcade also has some side effects, especially in the form of peripheral neuropathy. Even though we have gotten over this issue to a large extent by giving it subcutaneously and giving it once a week, it's still a burden for patients to have to come to the clinic once a week. Now, considering it's a chronic disease, patients undergo treatment for long periods of time, the ability to develop drugs that are given as pills clearly has an advantage for patients in terms of convenience. So the Ixazomib is the first oral proteasome inhibitor that has been developed and has been undergoing clinical trials in the clinic. The Ixazomib in this particular study was combined with Revlimid and Dexamethasone, trying to see if we can replicate what we saw with the Velcade Revlimid Dexamethasone combination, but at the same time have something that's completely oral that is probably better tolerated than Velcade Revlimid and Dexamethasone. So the clinical trial basically had a phase 1 portion where we found out the ideal dose of Ixazomib to be combined with Revlimid Dexamethasone. So we found out that 4 milligrams given once a week for 3 weeks out of 4 weeks is the best dose to combine with standard doses of Revlimid and Dexamethasone. So once the 15 patients were enrolled in the phase 1 portion, then we enrolled an additional 50 patients in the phase 2 study. So in the phase 2 portion of the study, we were able to determine that this combination is quite effective, comparable to what we have seen historically with the combination of Velcade, Revlimid, Dexamethasone. So we saw like 92% of the patients actually had a partial response or better, and 58% of the patients had a very good partial response. So high response rate, deep responses, kind of what we would expect from a proteasome inhibitor IMiD combination.
So where do you go next with this promising data?
So the next step is to do clinical trials with phase 3 clinical trials to see if we can confirm what we found in this particular study. Specifically, we want to look at the long-term tolerability of this medication. So we have some estimate from the clinical trial aspect that I'm going to be presenting tomorrow, which basically is looking at the long-term tolerability of Ixazomib given as maintenance therapy after the initial triplet induction treatment. So patients would, who have completed 12 cycles of this 3-drug combination would then just get one drug, which is the Ixazomib, once a week for 3 weeks out of 4 weeks. And the study, we have patients who have almost completed 2 years of that maintenance treatment, and we have found that to be very tolerable, very little in terms of side effects. And we also found that patients are having deeper and deeper responses as they continue on the treatment for long periods of time. So clearly, there's a role for the combination in the beginning, and there's a role for continuing this treatment as maintenance. But clearly, in the setting of a phase 3 clinical trial, it has to be proven. That will give us a sense of where do we place this new treatment and combinations in the entire treatment paradigm for myeloma.
But it seems like you can go into phase 3 with some confidence.
Exactly. And the phase 3 trials are ongoing right now.
Okay. So what are the key takeaways from where you are so far?
With respect to this particular study?
Yes, sir.
So I think the key takeaway would be that you can have a completely oral regimen which is very effective for treating patients with newly diagnosed myeloma. This drug can be given long term with very tolerable or acceptable toxicities, and you continue to see improvement in response as patients stay on this therapy for long periods of time.
Very good. Doctor, thanks, and come back and give us a future update, would you?
Sounds good.
Okay, sir.
Thank you.
Thank you.